Good evening, everyone. Thank you so much for logging on. I am Sheldon Martin and joined by my co-host, Rich Tripp. And this evening, we're holding a special webinar that we want to use to answer our approach. Really, we titled it An Alternative Approach to Pornography Treatment. We feel that this is extremely important that we start off right and let people know how we approach this sensitive topic, because there are a lot of different varying ideas out there. And Rich and I would like to be very clear how we'd like to do this. You might not be familiar with Rich or I if this is your first time logging on. My name is Sheldon Martin. I'm a licensed therapist and have been for about almost going on 10 years. I've worked with people. And I received a doctorate degree at Arizona State and have worked in a private practice during much of that time. Rich, do you want to introduce yourself?
Yes, I'm Rich Tripp. I'm a clinical mental health counselor. I work in Provo, Utah, and I'm also a certified sex therapist. And I've been working close to around the same amount of time, almost 10 years now in this area. So love the work, and it's a great opportunity to be here with you tonight.
Well, we wanted to start with, you noticed the title, An Alternative Approach. On this first slide, you will see multiple phrases that Rich and I hear in our offices all the time, many times regardless of situation or circumstance. I'm going to read the phrases that you can see, and I'm going to let Rich direct this portion to kind of tell you a little bit about some hesitations we have with these phrases that we hear often. Things like, I am addicted to porn. I need help. I'm a porn addict. I've tried to stop looking at porn. I think I'm addicted. Please help my child. He or she, they're addicted. They're addicted to porn and they can't stop. I just found out my spouse is a porn addict. Rich, would you speak to these phrases for just a few moments?
Well, yeah, again, these are very common phrases that we hear, particularly, as we meet with someone right at the beginning of their treatment. Oftentimes they're very distraught. They're worried about their behavior, and they come in, and the word and the verbiage that they have is very highly focused on addiction or being an addict or I'm addicted. And, again, that's why we felt it's so important to work on this alternative message, because there are, in our experience, a few concerns that we come across when we get caught up in this addict mentality. And on the next slide there, we can kind of, some of the concerns that we've found and gone over or have recognized. Do we go back?
Go back. Yeah, we'll go back one.
Sorry about that. So again, these are some of the other common phrases that come in. I've talked with people who've gone to addiction groups, and one of the first things they do is they'll say, my name is so-and-so, and I'm an addict. This, I feel, can be problematic because, again, here is someone who is labeling themselves by this behavior. And it has that tendency to bring in a lot of shame and guilt with it as well. The next statement there of once an addict, always an addict, it is something that is a fairly common phrase, particularly as we talk about pornography or even addictions in general. This one has always been difficult for me because if you were once an addict and you're always an addict, then what is the point of even trying to stop? It means that there really is no hope for being able to overcome. And professionally and personally, I think that we do a disservice when we say this because it really takes away the power of the atonement. And, if you're always an addict, well, what does that say about the atonement? Really, it kind of implies that the atonement wouldn't work in this area. And I just don't feel that that's true. Again, like I said, labeling an individual based on a behavior is dangerous. I have people who will label themselves addicts, and they may spend 2 hours a month looking at pornography. Well, if we added up all the time they spent going to church, serving in their callings, working, being with their families, there is so much more time that is spent doing all of these other positive behaviors, but to label someone an addict based on, this behavior, which is really oftentimes, even when it's severe, a small percentage of their lives, I think, again, is something that's very dangerous. There's also this idea of, I am powerless to this. I have to admit that I don't have power. And I think that along with this, a lot of times in addiction treatment, the idea is to turn that power over to a higher authority. And I think that is a wonderful thing to do, to get help from God, to draw in power from the atonement, those kind of things. But again, this idea of powerless means I can't do anything about it. And if we take away someone's ability to act and to choose, I don't think there's a whole lot of hope in that either. So overall, really what it gets into is this idea of a lot of shame and guilt associated at times when we talk about treatment in terms of addiction versus hope and godly sorrow. And that's really what we want to try and convey today, and with our approach as we work with people, is the idea of that hope and positivity, and that there is a way out from this.
Thank you, Rich. I'm going to speak to that last bullet point, and also there was a question asked in the middle here. Fascinating. I think both Rich and I would smile as we hear this question. Do most people identify themselves as addicts, or do they use other terms? In my experience, yes, and might I add, often very inappropriately.
99% of the time would be my guess. Yep. They'll come in saying that they're an addict or that they have an addiction.
Yep, it is. I could not count the number of times I've had this type of experience. A teenager comes in, something popped up on a screen, they looked at it longer than they wanted to, they closed it, they told their parents brought them in for an appointment with me. This was an isolated incident, and the parents' words are, my son, my daughter, they are addicted to pornography. It's often the only word that we know how to use. And so for the person that asked this question, we do not want to minimize the seriousness of the impact. But we also don't want to minimize the seriousness of the impact when we start labeling individuals according to their behaviors and telling them and teaching them in a way that there is no hope and that they can't change. This last bullet point of shame and guilt. It is Rich and I's experience that if a person starts to feel shame, that means I am this thing. I am an addict. I am someone. This is who I am. And when you start to believe that, it's difficult to change who you are. But guilt is different. I can be Sheldon Martin and use guilt as a way of, hey, I should not do this particular thing anymore. And that you can actually work on self-improvement and without it identifying your entire self. So great question. Great question.
Can I add to that too?
Please.
Because I totally agree with your definition of guilt there, but I will also say that I think sometimes culturally that assumption of guilt, we take it way too far as well. And that's why I like to go with the difference between guilt and godly sorrow.
Yeah.
How do we recognize what pornography is doing to us, the impact that it's having, those kind of things, recognizing that it's wrong. But I think sometimes we have a tendency to take guilt and just embrace it and beat ourselves up with it as well. And again, that gets into that problematic mentality. One other thing just really quickly is, again, with that shame quickly turns into hopelessness.
Yes.
And I'll tell you what, I've worked with a lot of people, and if you truly start to believe that this is hopeless, that there's no way you're ever going to make it, that you've lost all of your eternal blessings, if someone truly believes that, then there is no longer any reason not to look at porn. Because, if they truly believe they've lost those important things in their lives and that there's no hope of getting it, then they might as well at least have the excitement of porn and be miserable than just be miserable by itself. And so again, it's a huge thing that we want to try and resolve and work with and cut that out of their mentality as quickly as possible.
Rich, I would echo that. And could I mention one thing about godly sorrow that I often tell my patients, my clients, people I work with, or when I speak? I often say, listen, if it is godly sorrow, then why don't we allow and let God handle it how he's going to? Sometimes I've got to add the sorrow, right? I've got to convince this person how bad they are. I can promise you, and I can tell you from years of experience, the person involved, they know.
Yeah.
They know, and it's hurtful, but let that sorrow work within. Let God do that. We don't need to necessarily be the ones to heap it on. And our message is one of hope, because Rich and I have seen hundreds of people change. And we want to talk about, if not all exposure is addiction, if not, then what are the different levels of involvement? We used to get a little more heat on this. We used to get a little more, hey, there aren't levels of involvement. Then there was an Ensign article by Elder Oaks that talks about different levels of involvement. And so now people think Rich and I are okay again. So, Rich, do you want to go through here? I think the way this is divided up in that, so if not everything is addiction, that means that not every intervention is the same. So what are those different levels of involvement? Do you want to lead this? And I might add a thing here or there.
And again, I am going to take this pretty much directly from Elder Oaks and his article. And I think it makes a wonderful distinction. The first thing that he talks about is inadvertent exposure.
Yes.
This is not a sin. It's mistakenly coming across something. Mm-hmm. He says that it calls for correction. We need to be careful, learn from that, but that it is not necessary to repent from it. Again, because it's not a sin, repentance is not necessary.
Can I use an example here, Rich?
Yes, please.
I tell this to people all the time. I served my mission in Paris, France. I saw pornography all the time. That makes people feel uncomfortable sometimes, but the reality is advertisements were everywhere. If someone is getting to a point where they're now, I'm addicted because it's around me, there is, as though we do everything we can, inadvertent exposure is prevalent in 2017, and it's difficult to live in a war zone without getting a little bit of shrapnel on you. So, sorry, continue on, Rich.
No. This is going to happen. Really, if you have children, it is a matter of when and not if they're going to come across something that is pornographic, whether mildly or extremely graphically pornographic. It really is just part of the life and world that we live in at this point. The next level of involvement that Elder Oaks talks about is occasional use. He says that this is intentional use. It may be occasional or even frequent, and it's dangerous because it invites more frequent exposure. And this is, again, someone who goes to it willingly, is looking at it and using pornography, but again, still can be fairly mild in terms of frequency, in terms of type of pornography that they're looking at. But again, just like it says, it's this occasional use. The third level there is intensive use, and he says that that's repeated intentional use. It's a habit and almost involuntary, and there's a need for more stimulus to be satisfied. I will tell you that in the close to a decade and probably into the thousands now of people that I've worked with pornography, 99% of them fall into one of these two categories.
Wow.
And again, I think even as we start to see more and more the way that we have defined addiction, it really fits into that third one where, it's almost a habit, it's involuntary, you're needing more and more. That sounds a whole lot like addiction. But even Elder Oaks makes a distinction there that that's not quite to the level of addiction. And so again, we can see that a lot of people get caught up in occasional and or intensive use, and it's easy to say, hey, well, I must be addicted to pornography because I can't stop, and it's a habit for me, and I'm looking at more and more graphic types of pornography, and yet we're not quite there yet. And that's where the last one is, compulsive use or addiction. And this is where it's a dependency. It's this irresistible compulsion. It takes priority over almost everything else in life. People will sacrifice and lose jobs, family, money, possessions for their need to continue to use pornography. And again, like I say, I have worked with people who do fit that category. However, they are very few and far between in my experience. Sheldon?
I would say two things here that Rich and I want to emphasize. One, we're not trying to minimize any of these, because if any of these stages or levels of involvement goes completely unchecked, it can be, we see that it does become very progressive and can become progressive quickly. However, what we're trying to say is the reason this is such a big deal is that if you treat occasional use like an intense addiction, it increases shame and guilt. It increases shame and guilt. Now, another thing that I will mention, and we are not trying to minimize anything, but we're trying to really share our professional experience here. And I know this is sensitive, what I'm about to say, but in my experience with number 2 and number 3, most of the time the trigger is not even sexual. It's often an emotional trigger. It's often a life experience trigger. And that can become very, very sensitive. But as we look at this, it's very important to look at this complex problem as opposed to, oh, I'm just addicted to sex. That's what's going on. Because as Rich mentioned, that is extremely rare in our experience. So next, as we talk about this question, so why is the distinction important? Why is it important to understand? I alluded to it a little bit, but we wanted to go into it just a little bit more. Here are 4 things that were mentioned in this article that both Rich and I really very much see often and love. 1, not everyone who uses pornography willfully is addicted to it. This is so important. We've mentioned this over and over again. So Rich and I have had the experience of there is times where our therapeutic intervention is trying to help someone understand that they can move forward. We're not their bishop, we're not their stake president, but often we'll be sent someone because they have had maybe a mild incident and they cannot let it go. And they feel that they will never be good enough and deal with feelings of depression. We can help with this. We very much can, because not everyone who uses pornography is addicted to it. Second point, the deeper the level of involvement one engages in, it's more difficult to recover. Rich and I have also seen the negative impacts of the opposite side of the spectrum. Although rare, we see the worst of the worst at times. And it is absolutely destructive. And we should make sure and acknowledge if someone is on that path that we intervene appropriately early on. The third thing, if behavior is incorrectly classified as an addiction, the user may think he or she has lost agency and the capacity to overcome the problem. Rich mentioned this. You can see the problem with telling someone that it's too much. I had an individual ask me once. They said, Sheldon, if someone is being exposed to pornography, can they ever change? I had an answer for them. My answer was, I do not believe any behavior in this mortal world is stronger than Jesus Christ. That's my answer. Yeah. That's my answer. I don't believe anything is stronger than him. And so, of course, if we classify it as an addiction and say, oh, we just can't do anything about it, it's not healthy. Fourth, having a better understanding of where a person is in the process will allow us to better understanding of what action is necessary to recover. Rich, anything you want to mention about the importance of the distinction?
Yes, and just to go along with this last one, I was doing a presentation in a ward, and the bishop there, as we were preparing that presentation, was receiving a bunch of different types of information about pornography and addiction. And one of the things that was mentioned was, if anybody has ever seen pornography or used pornography, treat them like an addict. And the bishop asked me, he's like, Rich, so if I have a kid who has looked at porn a couple of times and it's been a couple of months in between each time, I should send him into an addiction recovery program with people who are in there 3 or 4 times a day looking at pornography. And I said, no, yeah, again, that's why these distinctions are important, is that we would treat that differently.
Yeah.
Again, a lot of that is just about increasing awareness. If it's that mild use of pornography, awareness, and there's a lot less probably depth that you go into even in therapy, because it's probably just a typical teenage kid who is struggling with some poor behavior, and we just want to modify that behavior before it becomes more problematic. And so, again, this idea of, well, let's treat everything like an addiction, becomes dangerous.
Now, and I would add, you guys have to understand, Rich and I are speaking from a psychology therapeutic background. So let's just switch the analogy. What if someone brought in their teenager to visit with Rich and I, if we're going to use psychological words like addiction, and said, hey, Johnny was out at a party one night and he drank a beer. He is an alcoholic. Will you fix him from being an alcoholic? Well, our first job is help mom and dad know that he's not an alcoholic. That doesn't even mean that we approve of the behavior or what happened. But we have a professional obligation to help them understand Johnny's not an alcoholic, and this is a very similar situation.
Yeah.
So we've talked a lot about, okay, you might be saying, we understand, guys, what you're not. So what are you? The term that's used more often than addiction, and Rich is going to speak to this because his classification, his certification as a certified sex therapist is very helpful. It's important to understand, well, what is, sexual behavior that's not working, or if it's pornographic and I can't stop it, if it's not an addiction. It's okay to use phrases like this: out of control sexual behavior. It's an actual term. Or problematic sexual behavior. It's okay for someone to be able to say, even if it's not an addiction, but this is a behavior that's out of control and I want to change. Rich and I are not saying on those three levels of involvement, the first three, do nothing about it. That's not our message. Our message is, if it's out of control and there's something you want to stop and feel that you can't, there are interventions to do so. Rich, please speak to these two terms, and then we're going to tell them our approach.
Yeah, thank you. One of the things that I like about these two terms is we're labeling the behavior and not the person. Again, both of them are talking about the behavior. And again, you can have someone who is caught up in addictive behavior, whether sexually or with pornography, and it is still out of control sexual behavior. It is still problematic sexual behavior. But again, this just gives us a more general way to approach it, which again will also help us to avoid the shame and the guilt that often come with those labels. And it's great because you can incorporate anything you want into there. And I'll say a lot of young adults and teenagers, is it just pornography that we're talking about? No, there may be sexting or sexually explicit chatting online, masturbation, fornication, sexual relations that way. I mean, it really can be all encompassing. And again, the idea of problematic as well is that we can base it on people's values. For someone, and particularly as therapists, if I have a client come in and according to their values, masturbation is not a problem for them and doesn't go against their religious or moral values, well, I am not going to pathologize that or make it a problem because it's not a problem for them. But this allows us to take people individually and be able to work with them in a way that is conducive to their values. So, well said, Rich.
So what is our approach? So we've done very good with saying, okay, so here's some things maybe we won't do that make us a little bit different. What is our approach? We want to go through this and speak to this just briefly. We want positive and hopeful interactions. I had an experience that changed me. A young man once who looked at me very tearful, who had a very minimal, mild interaction at one time in his life and tearfully said these words: "Is there any hope for me?" I was so bothered that he even got to a point where he thought that he was beyond hope. Rich and I, we don't serve the role as someone's ecclesiastical leader or anything like that. We can help in the role of being hopeful and being positive in a professional way to help them understand we have seen hundreds of people change. We've seen it. The reason that sometimes is difficult is culturally we don't always hear those stories. It's still more taboo for someone to stand up in a church meeting and say, oh, I used to really look at porn and I don't anymore. We don't hear those stories. But I think about it. We all hear stories about, oh, I used to drink and now I don't. I used to smoke weed and now I don't. I used to do heroin and now I don't. And we sit there and we say, wow, what a story. But we don't hear the stories of I used to look at porn and now I don't. But Rich and I are here to tell those people we see the stories, change is possible, and we're here. So that kind of covers those first two bullet points. Rich, anything you want to add and then cover the next two, and I'll chime in?
Yeah, I was just going to say one of the first things I do when someone comes or when someone's coming into my office to work on this is it is nothing but just hitting them with hope and helping them to understand. And it's not false optimism or anything like that, but truthfully allowing them to know that they can work their way out of it. It is heart-wrenching to hear, people say, is there any hope for me? Or I've had clients say, I don't deserve to live anymore, and have lost all hope that way. And so again, we have to be so much more hopeful in terms of how we approach this. So skipping down to the third one there, one of the things that we want to do is, again, help people recognize and believe that they have the power to change. Obviously, that includes drawing upon higher powers, being able to use the atonement, those kind of things, but they have their agency. And even in an addiction where it feels like agency is lost, you can gain that back. It takes work, but there is a way to do it, and the power is there. Again, I'm reminded of a church leader who was talking about pornography at one point, and he said, I think a lot of times we approach pornography as if Heavenly Father is just up in heaven wringing his hands, going, oh my gosh, what am I going to do about all this pornography that's out there? And it was interesting. The church leader said he knew what was going to happen. There is hope. He's provided ways for us to overcome this. And that's what we truly believe that we have here. And we've had the great privilege of being able to help people. Finally, one of the things that we do therapeutically is we try to get them to practice consistently cognitive behavioral skills, recognizing excuses that they make to act out with the pornography, recognizing their justifications, where they're vulnerable, really helping them get to powerful statements of truth that are really based in what their values are. Their values are not horrible, perverted, people who just want to watch porn. Really, these are great people who have great spiritual sensitivity and strength, who are sensitive, who are loving, who are caring, but this behavior has, definitely grabbed a hold and it's become problematic for them. And so we try to help them integrate those skills in a way and to practice it. It's got to be consistent practice to start changing this. And that's the approach that we take.
I'd agree. And let me add here, you might be wondering, okay, well, tell me a little bit more. Could I clarify something where I think Rich and I feel very strongly about? Why do we feel like we need to do this? Why do we need to have our approach? Well, here's what we think, here's what we feel, and here's what we've seen. Some programs offer a lot of support and are really shallow on skills. So someone feels very supported, but they don't know what to do. We feel that support and hope need to be matched with skills, and so we will do that. We feel that other approaches want to give everyone the label of addiction. Therefore, with addiction, we treat it this way, and we see those people who just have high levels of shame and guilt. We don't want to do that. We want to have a levels of involvement approach and understand that. The other thing that we feel that we offer is the venue. Rich and I, we feel very strongly about the venue that now this is private. That doesn't mean that it's secretive. but it allows the person to tell their story on their terms. We have people who are a little nervous or afraid to get help. We have people who, I'll just be honest, who because of their calling, I don't know where to go. I don't know where to go because of their job. It's too vulnerable. I can't do this. We want to offer a place where we're saying this is real, good help, professional help, in a way that you can do on your terms. You log in your home, and we're going to give you support, we're going to give you help, and we're going to give you the skills to help you move through this, based on the values that are important to you as well.
Great.
Rich, anything you'd add about that?
No, I think you summed it up nicely. Well done.
Other questions? We have a lot of you logged on. We sure appreciate it. We wanted to get this out and to say this is our approach. This is what we're passionate about. This is what we want to do. Are there some questions that we can answer? There were some great ones asked earlier. One question that came in, do they recognize it's an addiction? Great question. Depends on the person, depends on the case. Rich, would you agree?
Yes. I think it's almost either or. A lot of times they're thinking it's an addiction when it's not. Uh-huh. And those who really have an addiction probably don't recognize that it's
totally flopped, huh?
Yeah, they do kind of switch over that way. And so so the answer is no, not all. If they're really fitting that idea, that level of involvement of compulsion and addictive behavior, a lot of times they don't recognize it.
Great. What a wonderful question that just came in. I don't know the situation. I don't know the circumstance. I don't know who the person is that you're asking about. So please know that I don't want this to be overly sensitive. The question is, though, what is the first thing to say or do when a loved one comes out to you admitting a problem? I will say this. Regardless of the person, if they are coming to you, that is a vulnerable spot, and I would meet it with encouragement and love. Now, I know what I'm saying. I know that if that's a spouse, that's, oh man, if it's a child, there's devastation. But I will tell you this in my experience. If it's met with a sledgehammer, they will stop telling you.
Yeah, I would just add to that, I would thank them for coming to you, because it takes a lot of courage to be able to go to that vulnerable place and admit that there is a problem. So again, thank them for trusting you to come, to be able to come and admit to this. And whether again a spouse or a child, as hard as it is, I would say just embrace them and try to help them feel that hope, because oftentimes it's in those moments where they're feeling the most hopeless.
Great.
Any other questions?
Well, listen, here comes one. How do you help an LDS church leader who doesn't deal with a situation such as this the way you think they should? First disclaimer. Rich and I are not in a position where we're on a mission to tell bishops or tell church leaders what to do. That is not what we're doing, and I know that's not what you were suggesting, but we don't want to send that impression that, we're steadying the ark. I would say this. I think it is, having been in those spots, and Rich and I both been church leaders in these spots, I would say it's okay to, worth having the conversation. Instead of saying, you're not handling it right, sometimes we don't always know the situation. But maybe it's okay to have a conversation and say, I have some questions. I have some concerns. Can we talk about this? We need more communication on this subject, not less. Rich, would you add anything?
Yeah, you know what? Dear bishops are, oftentimes, to their own shock and amazement, thrown into a calling and into a position
where, a lot.
where, again, they have a mantle, they have help, they have inspiration, they have the keys to do this. But again, sometimes they don't know exactly how to approach this, and they do misstep it sometimes. And that's not a criticism. That's That's humanity. And so, again, being patient with them. But I would say that most church leaders that I've worked with or that I've heard of are more than willing to sit down and be able to counsel with you about your concerns, about how the situation is treated. I know sometimes, if it's a spouse, someone may feel that their spouse is getting off easy and there should be more consequences because of what they've done. And, again, it's good to talk with the bishop and maybe get his understanding of what's happening and why he decided to administer the consequences that he did. And so, again, just counsel with them. Don't be afraid of your bishop. Sometimes, because of all of the emotions associated with this, it's easy to get hurt. Realize that very few of them have any psychological or therapeutic training, and they're doing the best they can with the resources they have. And I think most of them are willing to counsel with you and try to help. So,
and I'd also add, now, I hope that this comes out the right way. Also be open to that sometimes in this process, someone might need to be confronted. And so just, you never want to be in a situation, Rich and I face this as therapists, where sometimes we're in a spot where we say, listen, like, you should be more concerned about this than you are. So we don't know the situation, but just be open. Just be open to what's going on there. And so someone asked another question, how do you deal with something if it's coming up again? They've gone through counseling and it's coming up again. I would say lean into it. I would say, Rich and I, our approach is a lot like exercise. It's not like you hit this pinnacle and, I'm in shape. I am done. I'm now in shape. It's what are you doing to get there? And then what are you doing to stay? One thing that Rich and I will offer, and we both feel very strongly about, is in our theory of change, there is a stage of maintenance. And so many times someone might feel that they have the skills, that they have the support, the behavior comes back. It's a lot like jogging and lifting weights. You got to jump back on the treadmill and start lifting. You've got to stick with those skills. Rich, would you add anything with that?
I can't see the question here, but yeah, I would just say that it is that encouragement to continue practicing. A lot of times I think we are looking for the overnight solution, whether that's with a loved one who's struggling or ourselves. What is the thing that I can do? And in a couple of weeks, I'm good and I'm not struggling with this anymore. But again, it is that consistent commitment to practicing effective skills and tools that really do help people keep this out of their lives.
Great. Well, those who are logged in, we have two things we'd like to request. One, we want to thank you. And the second is, Rich and I feel passionate about this. We do feel a personal ministry. We feel that it's timely. We feel that it's something that we would like to offer. We love that someone can access our content wherever they are. So the second thing we'd ask, would you help us spread the word? If you've gotten some benefit out of this, we're going to keep doing these. And then eventually we are going to grow into a time when we have some paid support groups where we run these things together. And we're excited for that. And please help us to kind of spread that word. Thank you for attending very much. Rich, last word, and then we'll end.
No, thank you. And again, the last word is hope. Whether struggling with this problem, whether watching a loved one go through it, always hold on to hope. It is there. We've seen it. We can testify to it. There is hope. And that's the message that we really want to send. Thank you guys for logging on. We really appreciate it.
Great. Have a great evening, everyone.
Good night.
Good night.